Hello, everyone. My name is Justine, and I'm a senior sales engineer here at SmartBug, and I will be the host for today's webinar, Patient-Centric CRM, Aligning Data, Process, and Human Care. I'm really happy to see all of you today. I see a few clients of mine, so really excited for this conversation to get started. All right, let's do a quick intro before we actually jump into discussion. So I am joined here today with two good friends from HubSpot. So we have Ali and Jordan. Ali is a principal solution engineer, and Jordan is a senior product manager. And they are here to answer some question that we have around how do we shift from a sales-centric CRM towards more compassionate care using the same set of tools. So we try to make this conversation as accessible as possible. We know that the healthcare vertical is sometimes very niche. So it was really hard to pinpoint what everyone could feel in terms of challenges. But first thing first is why patient-centric CRM matters in healthcare, and especially at this time. Second, we'll cover the cost of fragmentation in system and care, and the requirement for a patient-centric CRM. We've broken this down into 4 dedicated pillars. And finally, Ali and Jordan will walk us through real-life example and use cases with screenshot demo of HubSpot usage around patient-centric platform. So why this topic matters now? So this is really funny. This webinar is actually coming from my inbound speaking application. I join efforts with clients every day that are looking to provide more dedicated care. So they're not necessarily looking to get more patients. They are looking to provide a better quality of care. And out of the box, HubSpot has been labeled as a sales platform, as a marketing platform. With a really easy shift, we're able to bring more engagement, bring a more proactive conversation, and a patient-first model. So we will see how this can be leveraged and how this can play into aligning your data, your process, and your tech stack. So I guess my first question would be for you, Jordan. As we touch on the cost of a fragmented tech stack in the healthcare industry, why do you think so many healthcare organizations struggle with fragmented systems right now?
Yeah. Thanks, Justine. Yeah, I think a lot of it comes down to the inheritance of kind of a patchwork of systems. You start in one place with an EHR EMR system, and you bring in a scheduling tool. Then you start to think about marketing and engagement. And each of these were sourced and purchased to really solve kind of individual bespoke problems. And they weren't necessarily designed to talk to each other. And then when you throw in strict regulatory requirements like HIPAA and things like that on top of it, really becomes challenging to unify that data really around that patient. And as a net result, you kind of have this fragmented view of your individual or your patient you want to engage with.
That's true. And I find from my perspective, as we enable new users, the healthcare industry is sometimes reluctant to adopt new technologies, but when they are in on a new platform, they rely on really heavy rollouts. So as you mentioned, ended up with this scattered tech stack and those tools that don't necessarily talk to each other. And from your perspective and everything you see in your product ecosystem, what does it really mean to shift towards a patient-centric approach? And I don't know if Jordan or Ali wants to speak to that.
Yeah, I'm happy to chime in here. I think really being a patient centric approach in CRM means providing a really personalized quality of care. So when you are communicating with your patients, you're being intentional, you're reaching them at the right time on the right channels, whether it be email, phone call, SMS. And in order to personalize to each different patient's preference, you really need to have all the information around that patient to personalize. So I think it's really like having all of that data around your patient unified so that you can leverage that data to create a really great relationship and more personal relationship with those patients.
So when you see them as a strong owner and a dedicated owner, this is where we see the most value in a patient-centric approach, because there's one person that is accountable for that relationship, or that really 360-degree view of that full relationship, from patient inquiry to patient intake to post-visit surveying. So there's really a more complete dedication of the organization. I want to speak of what a patient-centric CRM actually requires. as you saw sales and marketing platforms, what does it take to reframe a HubSpot CRM or any CRM for ongoing healthcare relationship?
Yeah, that's great question, Justine. When I think about like traditionally what a CRM does, you're thinking about managing a pipeline, managing a sales pipeline or a marketing pipeline from identifying a lead, qualifying that lead, and closing a deal. You need to start thinking of it as really like a life cycle shift. The goal isn't necessarily to close a deal in the healthcare space. It's around like building that trust with the patient over time. And that requires the CRM to kind of support all these kind of different relationships across the life cycle of the patient, whether that's proactive outreach, reminders, coordinating care, personalized education. At the end of the day, like the mechanics of what the CRM is doing is the same, whether it's understanding and unifying that data, providing automation, and working through engagement with those patients. But the intent of like building that trust is very different overall.
And also, you want your CRM to reflect your healthcare organization, your structure, whether you're a small clinic or private practice. You need to really think through in terms of how do we roll this out so we can essentially rethink from sales and transaction towards more appointments and patient communication. So there's really a shift to do here. Is there more example that you have in terms of architecture and technology that need to happen to really support this?
Yeah, I can chime in here. So HubSpot does have a really flexible data structure to reflect your healthcare organization. So whether you're a private practice, you're a network of providers, maybe you're in B2B healthcare, selling medical equipment, we have out of the box standard objects as well as custom objects that can be created within the UI. So you don't need a dedicated IT resource to stand this up. It's not so bespoke and difficult to create. And so some examples I've seen with healthcare organizations are using our standard appointments object to track appointments for patients, send appointment reminders, understand patient engagement, and then use some different custom objects to represent things like clinics or diagnoses. And then you also have the ability to rename standard objects. And this is one of our newer releases. I've seen a lot of healthcare organizations rename deals to represent clinical appointments or rename the contacts object to represent patients. And so it's really flexible to be able to reflect however your healthcare organization operates. And that's really important because if your data is representative of your process, then it makes it that much easier to use that to provide the quality of care that you want for your patients.
Justine, we're having trouble hearing you.
What about now? Okay, very good. So just to rephrase before we move forward, so that patient-centric CRM approach, we required a shift in mindset. So we need to stop thinking of a CRM as something that tracks return on investment and with a financial aspect upfront. We need to rethink the architecture that might be coming out of the box so we can really tailor to our operation and processes. And finally, we need to shift in technology. So, Aaron, I don't know if you want to take the next question. I will make a switch in gear here. Okay, I think it should be better mic-wise. All right. I'm so sorry about this. So our director of marketing, Nikki, just pulled a new poll here for us. So this is all good in theory, but there's also a really unique reality of the healthcare industry that we need to deal with sensitive and patient data. So I want to know how confident you feel in your current systems if HIPAA-compliant. But it's always nice to see that people feel strongly about their system. And I think this is where I want to lean into Jordan's expertise about HubSpot approach with HIPAA compliance and sensitive data.
Yeah, sure. I can touch on that. Basically a year ago, this wasn't a thing for HubSpot. We officially launched last year, right around this time at our inbound conference, the support of sensitive data and HIPAA for our HubSpot customers. And we really built out with a mindset of being flexible to meet the needs of an organization, whether that's big organization, small organization, without throwing kind of additional add-on costs of compliance with like bespoke additional products on top of that. We've designed it in a way that you can choose what type of information you intend to bring into your CRM, deem it as sensitive. We throw additional layers of encryption on top of that data. And then everything surrounding that piece of information. So your patient record and maybe your you're logging notes about that patient or follow-up tasks or things like that. So everything surrounding that, we add additional layers of protection on top of that that really allow you to store this data, utilize this data to meet your needs, whether that's from a marketing perspective, customer communication, etc. You can store that all inside of HubSpot. And then where we're kind of taking it as we continue to innovate is that we want to see ourselves as like your compliance sidekick, right? Where you don't want to necessarily have to think about the data that's coming into your environment from a HIPAA perspective. But we want to be there to help you automate from a data retention perspective and identifying sensitive data that lives kind of outside of that structured format and really kind of give you confidence in what sits and lives within your environment and how that data is being used.
And as we shift the conversation toward those 4 pillars that we assigned to a patient-centric CRM, Ali, can you start with highlighting why it's so critical for patient care to have unified data in your platforms?
As I mentioned before, patients really have different needs based on things like diagnosis, location, communication preferences, level of support. And so you're collecting that data at various points of the patient life cycle. Oftentimes, that data is collected in different systems. And so when it's not unified and accessible all in one platform, your ability to really action that data to personalize your communications and increase that quality of care is really limited. So I think being able to unify all the data that you're collecting at that patient life cycle can help you increase that quality of care by tailoring your outreach, not having to ask the same questions to your patients every time, and increase overall patient satisfaction.
Thank you, Ali. And we already talked a little bit about the cost of fragmented data. Our second pillar that we want to highlight here is seamless process across the different platforms. Jordan, can you speak of where do healthcare organizations usually hit friction points?
Yeah, no, I mean, a lot of it comes down to that fragmentation. Usually it shows up in these handoffs, right? So like marketing passes to intake to care coordination, care back to billing, et cetera. Like those systems, if they're not integrated, they lead to these frictions. I have a very personal example. I love my daughter's pediatrician, great care, but I have this challenge every time I go in. My insurance information, my contact information is submitted up into the billing portals, but every single time I walk in, when I check in, I get a piece of paper printed out that I have to sign and verify all my information is the same. I had just done it online before coming into the office, but like every single time. And it's just this like small friction point that just like bothers me at kind of the back of my mind. At the end of the day, I'm here about the care, but like it is those like small experiences that begin to add up that can make for a challenging experience. So really streamlining those transitions is where like organizations see the biggest lift, I think, from like patient satisfaction perspective and efficiency.
For sure. And we have Nikki in the chat that says, as a field parent, I feel the pain of this too, Jordan. And we brought this information, speaking of pillars, but I feel they all tumble into each other where unified data allows for seamless process. And as we increase the use of technology and AI, there's also good opportunities for us to add personalization and customization in care via AI. Ali, let's talk personalization. Do you have any realistic example of what AI has done well in patient engagements for some of HubSpot customers?
Yeah, absolutely. So, the biggest place I've seen personalization with AI resonate with healthcare organizations is really in the content generation and patient education space. So, think of AI being able to assist you with the creation of content, educational content, whether it's blogs, landing pages around different types of conditions or diagnoses. So, instead of just like collecting all that patient information, which of course you can do through things like forms and sensitive data properties. You can also use AI to educate your patients around their condition if they want to learn more about it. And so I think it's a really great way to provide that more personalized experience of, hey, I was diagnosed with X condition. now I can go to this AI agent and ask more questions around, general information around the condition and symptoms. So I think leveraging that around providing that patient education and content is the biggest opportunity there.
And we will come back to real life examples on how several agents have been built. And we briefly touched on compliance earlier, Jordan, but I would be curious to hear a little bit about the specific features that HubSpot has developed in order to secure the data and stay in compliance.
Yep. So, I touched on it a little bit briefly, but we've taken the approach where we are viewing kind of the like target ideal state of current HIPAA regulations and rule sets, which is encryption is a kind of an optional requirement, but recommended if you're going to knowingly be handling PHI in the environment. So that's the standard we've taken. And on top of that, you have all the underlying other technical safeguard controls with role-based access, audit trails, et cetera. And then when we think about like AI usage and things like that, we have put restrictions in place for use of like our Breeze Assistant features and limitations on if you deem certain data as sensitive, that data will not flow through into the tooling, not be used to train the models, et cetera. So we put those restrictions in place with these guardrails so that we can continue to operate safely in this environment.
And I personally love the native audit logs that you guys have rolled out, because really often it's part of the governance plan that a customer will have as they onboard on the platform. With getting out of the box the feature where we have the full history of every single action, so admins can review, has been really insightful for several customers. So we spoke about those 4 pillars, and compliance was the last one. And for compliance reason, it was really hard to provide a live demo with meaningful data. So Ali was kind enough to provide us with screenshot of real examples on how several tools in HubSpot have been used across the healthcare industry. Ali, do you mind walking us through some features and how they are helping us leaning toward a more patient-centric approach?
Yeah, absolutely. Thanks, Justine. So as Justine mentioned, these are some best practices that we've collected based on how we're working with different healthcare organizations. So we'll start at the beginning of the process, which would be like a new patient inquiry or intake form. This is an example of a form where you can collect information around symptoms for a diagnosis. Think of gathering any type of sensitive information that you need in order to understand that patient's needs. So in this example, we're asking what they're interested in. You could position it as a question around symptoms. And then this is an example of like a sensitive data property that would then be converted into HubSpot's CRM and can be viewed and leveraged in tailoring your communication that way. And what we've seen is like a lot of organizations that aren't on a unified system might have like a point solution or a specific forms tool, or as Jordan mentioned earlier, maybe it's a piece of paper. And then it's really hard to transition that information. You might have intake teams manually copy and pasting that over, which we all know with human error might not always be the cleanest or efficient way of doing things. So think about this as really like getting the information that you need for that new patient to deliver the quality of care that you want. And then again, this is like a very similar but more comprehensive form with some styling. So as some of you might know as HubSpot customers, we have landing pages that are really customizable with drag and drop editors where you can change things like fonts and colors. So this is kind of that one level up. And here are just more questions around the client, their expectations, what their symptoms are, what they're looking for. I think this was a med spa clinic. So it's asking some questions around, symptoms. Do they have acne scarring? What kinds of services they might be interested in? Again, just gathering all the information you need during that patient intake process that would go directly into the CRM.
So pushing your other example, once this form has been submitted, we can use this data.
Yeah, this is really great. And I think where the power of personalizing and building more trust with your patients comes into play. So now that you have this data around symptoms and conditions stored as sensitive data properties in HubSpot, you can use what we call workflows, which is HubSpot's automation engine, to personalize and power that automation based on something like a condition or a diagnosis. So in this example right here, there's a lot going on, but what I'd want you to center on or focus on here is those little branches that you see. Each branch represents a different type of concern or condition around skin. So again, this is like a clinic focused on providing services with skincare and skin conditions. And so you see we have a branch for sun sensitivity, acne, scarring. And so what's great about HubSpot is now I can create different types of emails to be sent based off someone's concern. So if I fill out the form, I say I'm concerned about acne scarring. Now you know that as a patient, that's my concern. Those are my symptoms. And now you all can create really great emails, educational patient emails around, hey, here are 5 ways to improve your acne scarring. Here's our recommendations. Here's preventative care around staying out of the sun. Come book an appointment with us, right? Leading them to, book that appointment through something like a meetings link in HubSpot. So this is where the personalized care comes in. You're creating branches based off of each type of condition and then able to send communications or maybe even ping certain practitioners or teams based on those conditions versus before you might be sending really generic communication or teams might be manually doing this today, which of course takes up a lot of time.
So really the data turn into action. So next example we have a screenshot of a demo patient record.
Awesome. Yeah, so we talked a lot about data unification, and this patient record is really a demonstration of unifying all of that different data. Think of it as a representation of your patient. So on the left-hand side here, we have some sensitive data around things like their current medical conditions. So you can see diabetes, sun sensitivity. You can have some data around whether they're a prospective patient or a current patient, things like their phone number. As Jordan mentioned earlier, maybe there's some specific documents or information related to insurance. You could have that as attachments on this record. So again, you're viewing and accessing everything in one place. On the right-hand side here is where you can view any type of appointments. So I mentioned earlier, this is an out-of-the-box standard object that can represent any past appointments, future appointments. And so when you're trying to provide that quality of care, you go in and check in as a patient. You can say, okay, last time we saw you was 12 months ago. Looks like you have an appointment in 6 months versus having to rely on the patient and asking them more and more questions. You can also create relationships in HubSpot. So if you are a family practitioner and you are providing a level of care to the parents, but also the children, or maybe you're getting some referrals in from family friends, you can represent those relationships here. So it's really small, but you can see, person is the daughter of this patient, representing it with an association label that says child. If you also want to represent like referring physicians, so maybe you're a specialty practice, you can also make sure that all of those relationships are represented right here under that contacts on the right-hand side.
And if I can add to this, Ali, like I always love this type of view because if you are in the healthcare leaning more toward the B2B side and you needed to attach a specific patient with a clinic or referral or hospital or practitioner with practice point of services, this is where we can create those associations in the right panel. And also the middle lane, I always speak for the front desk workers where they have the full view of everything that ever happened with that patient in terms of communication. So if they called in and they received a promotional email, if they had a one-to-one email with the practitioner that morning, the front desk person gets all the context and information to provide the best and most straightforward quality of service, where a more fragmented tech stack would require probably to look into several platforms or put a person on hold while we're fetching the correct information. So really like that straightforward and ergonomic view is so valuable.
Absolutely. And a lot of healthcare organizations that we speak with are interested in also integrating like their EMR or EHR. So any type of data that they might hold can also be integrated and then surfaced on this contact record as things like properties on the left-hand side, or even on the right-hand side if you're storing, things like appointments in those systems. But as Justine mentioned, you see on this record right here, all the emails that were sent to that patient. You can see that there was a note about a missed care appointment. So if you are front desk, if you are checking in a patient, no more pulling 3 or 4 different systems, no more asking the same question to the patient. everything is unified right here so that you're really providing a personal level of care for your patient there.
Having a unified and centralized place for your data also allows you to pull stronger and more complete reporting. What do we see here?
Yeah, so this is a patient consultation pipeline. And so, what I mean by that is oftentimes when we speak with healthcare organizations, they might have like a first time client consultation, and then they might struggle with ongoing patient care. So, they want that patient to come in annually, whether it's primary care or specialty type of care, but they might struggle with that patient retention. And a lot of that can be due to providing a good level of care, but a lot of it can also be trying to understand where is their friction or where is that quality of care dropping off. And so this is a conversion report to understand of all our created appointments and in this appointment scheduled, how many actually converted to a complete consultation, how many actually converted to a treatment sign off where we're actually prescribing certain types of medication, and then how many actually came into secondary consultations, and did we sort of like complete that level of care in our patient life cycle. So this is a very generic, general sort of visualization of how a patient journey might look. But of course, you can tailor this to the different types of stages your patients go through to understand, hey, like after we have our first consultation, we notice a lot of our patients aren't coming back. Now that we can see that, how do we evaluate our process and provide a better level of care to retain patients? But I also want to make a note here, like patients are not output. So this is not just a linear, okay, now they're closed one, they're an official patient, it's done. It's really an ongoing process. So there's other reporting in HubSpot that you can create too that represent like ongoing patient care. So this is their second, their third consultation, really making sure that you are building that trust throughout all the patient life cycle.
Yes, we've seen a lot of value in creating reporting around no-shows as well and trying to identify trends around is there any action that is taken prior to an appointment that can actually minimize the count of no-show? And now with AI tools, it became even easier to identify those trends. So as long as the data is there, there are ways to lean into the data to enhance our practice.
Absolutely.
So moving on into a more infrastructure shift. So we spoke about EHRs. We spoke about having spreadsheets for certain, I want to say like roles in certain practice. Ali, a lot of teams still live, whether it's in spreadsheet or action only EHR workflow. What is the biggest difference when you add a CRM as an engagement layer?
Yeah, really great question. And you might start to notice a theme here. It's really making the data actionable to provide the personalized level of care. So spreadsheets are great if you're just looking to track information. I know spreadsheets and Excel can create some pretty cool reports or pivot tables. But what Excel and spreadsheets can't do is it can't actually automate tasks to, your care team or your intake team or a practitioner to follow up based on a condition or follow up based on a missed appointment. It can't send educational, emails or SMS around a certain type of condition or appointment reminders and things like that. And so when it comes to improving patient experience, unified data is really the first half of that. And yes, you can try to unify all your data in something like a spreadsheet or even an EHR, but you really need that second layer to facilitate communication and make that data actionable when you're personalizing your communication and quality of care with the patient. So I think that's really the biggest difference is that kind of actionable data engagement layer that the CRM offers. I would also say too, cross-team collaboration. So, depending on your healthcare organization, you might have an intake team or a care team, administrators, practitioners. You might get referrals from specialty practices. And so there's all these different teams that might be working out of different systems or spreadsheets. And the value of the CRM is because you have all that data unified in one place, it really fosters that cross-functional team collaboration where maybe a caretake member can tag a practitioner or an administrator and say, hey, they missed their appointment. Can you give them a call, or we should follow up in 6 months, without having to necessarily like pick up the phone or write it on a sticky note.
And just to give a real life example from this morning, I have a customer that we are onboarding into HubSpot, and they have all the insurance provider hosted currently on an Excel spreadsheet with all the information that each provider capture. And each practitioner in their practice will be tailored toward really specific insurance providers. And they want to roll this out inside of HubSpot as a phase 2. But when you lean into such a flexible model when it comes to objects, we were able to create those insurance providers as a custom object. And then like from a reporting standpoint, and as they grow on the platform, like we will get immediate value from that shift in infrastructure and thought process. And Jordan, you've supported a lot of the healthcare rollouts at HubSpot. Like, how do you guide a team from thinking of CRM as a care infrastructure?
Yeah. So like CRM, customer relationship management, in the healthcare space, you can almost like re-anchor the C in CRM to like from customer to care. It starts with these use cases. Instead of tracking deals, you're tracking these patient journeys that we've talked about. Instead of forecasting revenue, you're trying to forecast your care demand and how to staff for it. And then once these teams like see the platform really as this infrastructure that supports end-to-end scheduling, education, follow-ups, retention, it really becomes much more natural to operate in this kind of patient-centric mindset and kind of groundswell the effect of organizations trying to roll out a CRM platform.
Yeah, and I'm curious with the participant that we have here today. So Nikki's gonna roll a new poll. Do you feel that that your CRM is built for healthcare? Is there any level of customization that's been done to in out of the box tool, or are we leaning toward the platform that is 100% dedicated to the healthcare industry? But really curious to see the answers. Hey, Nikki, we can close the poll. Okay, so yes, but it's limited, almost equal to no, it's a general purpose CRM. HubSpot, I think at one point could be was considered a general purpose CRM, but the level of customization you can lean into from the out of the box tools makes it like tailored and customized to the healthcare industry with some thought process and a bit of a lift. The next topic I want to bring here, I know it's something that we had a lot of questions about, is how do we lean into AI in healthcare CRM? So we will speak mainly of the 3 agents available in HubSpot. So I guess my first question will be for Jordan. AI is on every healthcare leader's radar. Where should they start if they are worried about, let's say, compliance?
Yeah. So I think first and foremost, it's like building trust in the AI tooling you're using. Like HubSpot has taken a very like measured approach with building fast, but also being very cognizant of compliance perspectives. We talked about a little bit earlier around sensitive data not being included in AI in our Breeze Assistant features to mitigate that risk. But at the end of the day, it's like where you can start with like low risk, high value applications. So that's automating internal workflows, summarizing information, generation through the content agent, as Ali alluded to, surfacing reminders, patient education with the customer agent, things like that. Those don't require exposing patient data to external models. And I think over time, as there's a continuation in the maturation of like governance behind these AI tooling and frameworks, I think the level of comfort will continue to expand. I think we're just still in like the infancy of where this functionality can lead to, but it's got to be done in a pragmatic way, especially with like highly regulated industries such as healthcare.
Yeah, that low risk, high value usage has been my mantra this year. Just to give you one, like everyone loves stats. So one stat that I share a lot is I have a customer of ours. It is a specialized clinic with multiple point of service. And in January of this year, they request that for administrative tasks only, everyone could use AI, should use AI 15 minutes a day and would document the way that they would use AI. And after 6 months, they went back on the drawing board, and their highest adopters had seen an increase of 8 hours in productivity, where just from an admin perspective, they gained 8 hours of their week back. So they could focus on being, whether it was more present to the patients or just on higher value tasks that they could focus on. Ali, do you have other example on how healthcare organization are using, whether it's content agent or customer agent, to improve their patient care?
Yeah, absolutely. So I'll give one example of each. I kind of touched on this before, but content agent leverage to create things like patient guides or information around certain types of conditions I've seen to be really beneficial. A lot of marketers are using it just as a jumping off. We know that you all will proofread, add, remove certain types of content, but just being able to leverage it to accelerate the development of some of this content around patient education, and then to connect it back to using this content to sort of improve that patient experience is then you can feed this into the customer agent. And as a patient, I can go in and ask basic questions, right? Like, what are your hours when your clinic is open? How do I book an appointment? What types of conditions do you focus on? And all of that information, right, is really decentralized on your website, or maybe you have a separate meetings link, right? Like all of that would be centered in HubSpot for the agent to access to redirect patients to book. I think of my own experience if I'm trying to like book an appointment and I view a specific blog post around all the practitioners and their experience level, and then it's like, okay, fill out this form to book a meeting. Think of your customer agent being able to triage that. There doesn't need to be any collection or analysis of that sensitive data. It's really just giving information around things like clinic hours, conditions they um, help treat, and maybe redirecting that patient to book an appointment. So those are definitely some low hanging fruit use cases that you can leverage AI.
And we haven't touched, and I don't want to forget that specific niche as well, but we worked with a healthcare organization that are geared toward medical devices, and through e-com effort, they're able to lean on the order object in HubSpot, or we can get the shipping information. So for someone to be able to access their shipment status or their order status through AI, but this is only as good as the quality of the data that is hosted inside HubSpot. So Jordan, how do you think about a unified tech stack adoption versus AI accuracy in healthcare? Can you speak to this a little bit?
Yeah, I think all of it kind of ties into what we've talked about. Like Justine, your example of like the admin tasks and the like 15 minutes a day and like really building that like muscle memory early is like super important for getting a foundational understanding of like how to interact with AI, understanding how to prompt it and ask the right things so you can properly get to the data, and then back to kind of everything Ali's been preaching on the unified data. Your AI functionality can only work as good as the data behind the scenes when you're building out your docs and your education pieces, so that customer agent can leverage that. Like at the end of the day, it's only going to be as good as the inputs you provide it. And so really like laying out a strategy of where you want to go and building kind of that culture from the ground up um, of where we want to see ourselves using AI and how do we get there. I think is ultimately what's going to lead to like just further accuracy and kind of the patient care and the journey for healthcare organizations.
And I feel like this slide alone could have been its full like 1 hour pick. And it's the type of subject that we at SmartBug absolutely love to tackle. So by the end of the webinar, Nikki will share hyperlinks, but please feel free if you want to have like a brainstorming session with one of our AI experts. We just love to hear about your pain points of how can we work better and smarter, leveraging the AI. I want to say like once again like low risk and high value. So definitely like more conversation to have here. So we are coming to the last 10 minutes, and we already had one question from Paul. So to recap, what a patient-centric CRM delivers? First of all, it's a personalized care communication from patient intake to post appointment. This is a way to integrate outreach across departments and role within your practice. And what we're looking for really is loyalty for experience, not just treatment. I have someone on the call here today that said to me once, like, we don't have necessarily more providers. We need to focus on the quality of care we're giving. And that really stuck with me. And finally, getting measurable ROI or measurable data points that you can action across all your platforms. Jordan, if you had to summarize, what do healthcare organizations get when they make this shift? Like, what's the first sign that a system has become truly better and more patient-centric?
Sounds a little silly, but like when the patient doesn't have to repeat themselves, right? Like we all go into our clinicians and we're interacting with nurses and doctors and NPs, et cetera. And you always like repeat your name and date of birth. Like that makes sense from like inside the clinical, actual the care perspective. But like when I don't have to repeat myself in creating an appointment and I'm a returning patient, or when I come in to check in, I don't have to like repeat my insurance information or my address information. That like taking out those pieces really like gives me as a patient a holistic picture that like my care understands me, like and they know who I am, and like I think that goes a long way in like delivering that loyalty through experience.
That's great. And Ali, like, before we take questions, if you had one piece of advice for healthcare leaders that are starting their journey, what would it be?
Yeah, really great question. And through my experience of working with different healthcare organizations and seeing them really transform and digitize, I would say be open to a different way of doing things. We all know that this is a highly regulated industry. So there are certain things that you just can't do because of HIPAA and other regulation. But there's so much low-hanging fruit that we discussed today and mentioned today. There are some clinics that might not have any type of um, public resourcing around patient education, preventative care, or even like a bot that can just surface things like clinic hours or redirect to booking appointments. There are just so many quick hit wins that can help patients get what they need and really provide like a really great patient experience. So yeah, just be open, especially with the development and acceleration of AI. Again, we know you're working within certain guardrails, but there definitely are things that you can do to be more patient centric.
Thank you. Thanks to both of you. So, before we take any question, like you heard me speaking about like several clients that SmartBug supports on this webinar today. Just know that like this is a topic that I'm really passionate about. We deliver HubSpot, like a wide variety of HubSpot services across multiple type of healthcare clients, such as senior living, care coordination, and many more. So feel free to, once again, make good usage of the hyperlink that will be shared, and I will be more than happy to brainstorm and bounce ideas. Nikki, do we have audience questions? We already have one. So Paul, you asked, could you use HubSpot for senior living or longer term care?
Yeah, I can chime in here. Absolutely. We've been speaking with actually a good amount of folks in senior care in that space. And what we found is that they're using a lot of different point solutions like a MailChimp or a Constant Contact, but their biggest challenge is all of the data is decentralized and it's resulting in a lot of manual processes. And so similar to that patient record that we showed today, that could represent maybe the parent that is evaluating that specific senior care living facility. It could represent the senior themselves. And then when you're, maybe booking tours of the senior care living space or following up or educating them around the different benefits of that living space, HubSpot can really do so much to personalize and follow up with those seniors or the parents of the seniors that are evaluating. So definitely a great fit.
And that contact to contact relationship that you highlighted with the screenshot earlier, it really highlights how maybe a couple that is looking for units together might become two separate contacts because they have their own needs, but at the same time, they remain associated together when you can have a summary of everything that's happened with both records. Do we have more questions? So how does SmartBug help clients with system governance and maintaining data and quality across integration? So I will take this one because it's service-based, but we do have a full governance plan that we are able to roll out. It's a series of workshops where we document all the requirements, and we make sure that this translates into actionable permission set inside your HubSpot ecosystem. So from an operation perspective, you can ensure that whoever needs to have access to the sensitive data as view on those fields, and whoever doesn't necessarily need to have access to that information is prevented to do so. And it's all part of a very standardized and vet through process that we've implemented across several clients. What is the best way to track referrals? So maybe a contact is in skilled care, but referred to assisted living or a at-home care. Ali, do you want to?
Yeah, absolutely. I've seen this done a couple of different ways depending on the nuances of the referral process. So for the referral itself, you could just have that be a form fill to refer to a specific assisted living, a specific unit or specialty care there. But then to actually track the referral on the back end to understand, did that referral eventually become placed in a unit, that would be in what like we call a referral pipeline, right? So there are different stages of that referral. In senior living, maybe it's okay, they had the tour. The next stage of the referral pipeline is we sent them follow-up information and sent them a preliminary contract or deposit. So those are kind of the two different ways that we see folks, whether it's senior living, but also things like patient referrals is really leaning on the forms to collect the information and then the referral pipeline to track the stages of those referrals and the status.
I also have seen the the contact object used to refer to the individual that are putting in the referrals, so we can track how many recommendation referrals are coming to a really specific specialist or caregiver. I see that Nikki and Ali have been active in the chat. We are at time. So the last slide here are a few resources. You also have my calendar link is not there, but I will make sure that we have a calendar link for you guys if you want to pursue the conversation offline. Thank you for joining us, and Jordan, it was really great to have you. Ali, thank you, and I hope that we can continue on another topic in another session moving forward.
Thank you.
Yeah, thank you. Thanks, everyone.